there has been 3,000 cases reported in the last 24-hour period. A new variant has also entered the playing field, making things a bit more difficult in the fight against coronavirus pandemic. But the rage must go on, says the organizer of the music festival taking place in KwaZulu-Natal this week, as well as in the Western Cape. Last year, the festival labelled as a super spreader, but organizers say attendees will be expected to comply with strict COVID-19 protocols. Professor Barry Schoub from the Ministerial Advisory Committee on COVID-19 vaccines joins me now to discuss this. Thank you so much for your time, Prof. We appreciate it. I think let's just start off with how dangerous it could be for South Africa to allow such a massive event to take place while a new variant has been identified that's possibly highly transmissible.
Yeah, good evening, Heidi. I think it's, my own opinion, I think it's very ill-advised. I mean, we know that these kind of get-togethers where people are close together, often without masks, raised voices, which is generating more infectious droplets. This is really the recipe for a super-spreading event. And we know that there have been, we've observed it, quite a significant number, what we call breakthrough infections. In other words, people that have been vaccinated who still get infected. Fortunately, the majority of those, in fact, all of those have really been mild, or certainly the great majority have been mild infections. But nevertheless, they do act as a source of infection, which can be transmitted to other individuals who may well be more vulnerable. So I think kind of having some kind of festival like this, and even providing the assurance that people will be vaccinated and protocols will be observed, I can't imagine how one has a social distancing, physical distancing protocol, people continually wearing masks, people not raising their voices at a music festival. I mean, clearly one needs to kind of use a bit of logic to see this is really a high-risk problem.
Certainly, and if we just look at what happened last year, December, that drove our second wave, and with the beta variant being identified, many ask the question, has our government not learned anything? Why are we not learning from our mistakes from last year, December, where the country went into lockdown and the beta variant drove the second wave? Many would say that even with these strict protocols and regulations that those attending this festival need to adhere to, it still doesn't provide sufficient coverage or safety, because we do know that those attending this festival are possibly between the age of 17 and about 20, and they've just been vaccinated, and it's only one Pfizer dose.
Yeah, I think that the vaccine is going to provide only very, very limited protection in that kind of situation. This is really the kind of environment, the milieu, where you're going to get high levels of virus transmission, and looking at large numbers of people, even if only a relatively small minority are carrying the virus, it's going to spread very, very rapidly, and they're going to act as a reservoir to spread it further into the population. So I must be honest, I cannot understand how it could be allowed to happen, particularly now as we're going into our fourth wave. And this is precisely, as you mentioned earlier, what triggered off the second wave. So now we actually probably going into the fourth wave, all this is going to do is just magnify the epidemic considerably.
Especially because there isn't enough data out yet around the Omicron variant and how effective the vaccines that South Africa is rolling out, how effective it is against the Omicron variants. Just maybe speak to us about any information that you have regarding the Omicron variant and how effective the vaccines we have are against this particular variant.
Yes, Heidi, the efficacy of the vaccine to prevent infection with the Omicron is still being evaluated in the laboratory. There are tests being done to see if neutralizing antibodies, which people do produce after vaccination, will neutralize this particular variant. We don't know yet. These tests are still being carried out. They are very intensive tests that will take a little while, probably a couple of weeks, before we get some information from the laboratory. Meantime, we can observe what's happening out there in the field. And what we do see is that there have been quite a number of breakthrough infections. We assume that many, if not most, are due to Omicron, but we'll have to kind of wait and see. But how extensive the vaccine escape, it's still too early at this stage to make a definitive comment on it.
Sure. I think if we can just go back to Rage, and many would say this is not only the only super spreader that South Africans should be worried about. For example, with elections, there was a lot of gatherings, there was campaigning, people were gathering a lot more than usual. But how dangerous is it for government not to look at these red flags and this alarm bell to say perhaps we should rather avoid having an event like Rage again because of what it did in December last year?
Yeah, no, I agree. I think Rage should not have been allowed to take place. You know, the other mass gatherings, I think one always has to weigh up the public health risk and the public health imperatives as compared to the economic imperatives. So it does need, and also the other health imperatives as well, because you know, if one has too severe restrictions, it can also impact on other preventative health things. So it's always a kind of, one has to look at it holistically. But certainly something like the Rage Festival, I would think really should be a no-no.